Kirsten, hello, how are you?
Okay.
I looked at Jenny's X-ray and CT scan images, and unfortunately, she does suffer from craniosynostosis, as we suspected. The images show that her suture has closed prematurely.
Okay.
Baby skulls have openings called sutures, which allow the brain to grow. When the brain is in the first year of growth, it triples in size, and after that continues to grow until they're about 12. Can you tell me a little bit more about Jenny's symptoms?
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her. But I was sure something was wrong. She's in a lot of pain.
Oh, I'm sorry to hear that. Jenny has the condition craniosynostosis, but her skull shape is almost normal, which may have made it more difficult to diagnose. Craniosynostosis is uncommon, so many doctors have difficulty detecting cases like Jenny's. Just to explain a little more to you, as Jenny's brain is growing, it needs to be able to push the skull bones apart, giving it room to grow. If there is a fusion in the suture, then the growth is inhibited, causing the brain to be squeezed. Intracranial pressure is extremely painful, so I'm really impressed at just how brave Jenny is. She is a strong child.
Yes, that's true, she is. So, what are the options?
Well, my biggest concern is reducing the intracranial pressure. We can do that with surgery.
Surgery? That sounds really dangerous. My pediatrician thinks it can be fixed with a helmet.
If the sagittal suture hadn't fused, then a molding helmet might work, but not now. Every surgery has several risks, especially head surgeries. Jenny is otherwise healthy, so that greatly reduces the risk. We'll double check to make sure that she doesn't have any heart or lung conditions which might represent a contraindication to surgical treatment.
I'm just really concerned. What exactly will this surgery involve?
Well, you've got two options. Jenny's only 6 months old, so we can go with either a traditional surgery or we can go with a more kind of minimally invasive procedure. Let me explain the two. With the traditional approach, we make an incision from one ear across the head going to the other ear. It's usually the only scar, and normally the hair hides it. Once the incision is made, then the affected areas of the skull are removed. We create an opening for the brain to grow, and we reshape those bones, return them to a normal position, and then stitch it up using dissolving sutures.
This sounds really difficult.
I won't lie to you. It is. It's a big surgery. It can last up to 8 hours. Craniosynostosis is complex. The operation involves the expertise of a number of different specialists working together. And after that, Jenny would have to be in the hospital for about 3 days.
If Jenny has this surgery, do we know that she'll be without pain afterwards?
Unfortunately, there's no guarantee that the condition will be completely gone after the surgery. In some cases, some children have some residual pain. We can usually manage that with medication. For some children, there might need to be a second surgery, but that's very rare because the success rate's very high. It's over 98%. We've been performing the surgery successfully for many years.
So, sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I just want to be sure. So, what about the other procedure, the minimal one?
No worries. It's great that you ask a lot of questions. With the minimally invasive endoscopic surgery, we normally do that on children when they're, quite young, usually younger than 6 months. We use an endoscope to open the suture. The procedure only takes about an hour. She would have to spend one night in the hospital. She could probably go home the next day. After that, she would need to wear a molding helmet for about 6 months. We need to check it every 3 months to make sure that the sutures weren't closing early. It's a simpler procedure, but it can be equally successful, especially when the baby's very young.
Okay. Is the helmet painful?
Don't worry, it's not painful. It will be custom made. The success of the treatment depends on how consistently the helmet's worn. After about 6 months, we'd know if the growth was normal. If not, we may need to do another surgery. The second time, it would need to be the longer traditional surgery. Both types are complex. We have to work with a team. My team includes a plastic surgeon and neurologist.
This is all overwhelming. How do I decide what's best for Jenny?
I'm sure it's overwhelming. There's a lot to consider here.
So you're pretty sure she needs surgery. A helmet alone won't work.
Unfortunately, it won't. There's been fusion and it has to be corrected surgically. Plus, if you wait a month, then the simpler procedure won't be an option because Jenny will be too old for that. We typically perform the endoscopies on 2 to 3 month old babies. If I were you, I would consult some other specialists in the field. The more information you have, the better off you'll be.
Okay.
I'll have my assistant print out a list with the contact details of my colleagues.
Thank you. This is very stressful.
I understand. I know it's stressful and exhausting. Do you have family or friends you can help you out with?
My mom.
It's good that you have your mom to talk to and for support. Any other questions I can answer?
No. This is all really helpful.
Good. Well, let me give you a pamphlet, actually, on craniosynostosis and the treatment options that you have.
Thank you.
I know it's a lot of information. Again, if there are any questions, please do let me know. We'll schedule another appointment so we can discuss them.